You were just telling me backstage, I mean, that's a long job title, but your network, you oversee 4,400 physicians
4,400 docs.
in how many locations?
About 320 right now.
And with a budget of like $4 billion?
Yeah, about $4.5 billion.
Am I allowed to say that? Was that like
No,
off the record?
It's okay.
Okay, so I want to start back in 2014 with the decision to open this men's center at NYU Langone. And at the time, it was sort of revolutionary. And I'm hoping you could talk to me a little bit about the conversations that led up to that founding.
I can, but I'm going to go back a couple.
Even further, I love it.
Go back because I think it's important to put it in context and set the narrative. NYU Langone Health, as I think a lot of people know, we're a pretty large healthcare system all over New York region and Florida, and our strategy has always been about ambulatory care. So our current CEO,
And just define that, that's a technical term.
Our current CEO, Robert Grossman, decided that putting physicians closer into the communities where people live, building facilities that would take care of people outside of the hospital, which is what ambulatory care is, keeping them out of the hospital, was a good strategy for us. So there are hospital systems in New York, around the country, where you talk about dozens of hospitals in a system. We've always been a system that focuses on outpatient care, and we have now 5 hospitals to support that physician network. So that strategy, you know, back 25 years ago was a little different than what was happening in the healthcare space. So it gave us a good leg up to be able to get to 2014, where we had a decent size physician network, not 4,400 doctors, but you know, a good number. And we were, we were starting to realize, this strategy we put together actually really works, and it makes sense. So what do we need to do to keep differentiating ourselves? Because people are always trying to catch up to the people who are leading the pack. And we were looking around and we realized, our outcomes are great, our facilities are great, our doctors, of course, are amazing, but we don't have a place where men, or it's men today, but also women, could go exclusively to get healthcare that met their needs. So it was literally just us basically thinking, well, we've got the outpatient ambulatory care part figured out. Now how can we take it to the next level and focus on a segment of the population, as you pointed out, doesn't always have the best access or outcomes to healthcare?
And it's about access, of course, about having that ambulatory and that point of entry, but it's also about the network. Tell me a little bit about how you built out that network and the referral system and how it sort of all works to give full body, full mind health.
Yeah, so, men in particular don't necessarily think about their health care until something's wrong or somebody tells them that something's wrong. A friend said, that's not right, so you're doing something wrong, or literally they just finished a run and they can't walk. So their first experience with the healthcare system is usually overwhelming, and they don't know how to get access into it. So we put a lot of effort into, as I'm going to go back to the Men's Center, and then I'll tell you about how we actually reach out and get to these people. But we hired physicians, your physician in particular, to lead our Men's Center and sort of help build the clinical programs that we knew would tailor towards men. Whether it be orthopedics, you're going to hear from Dr. Jazwari today, great sports medicine physician, cardiologists who focus on men's cardiac issues. There are female cardiac issues, so we have female cardiologists as well, but not at the Men's Center, obviously. So starting to build out programs that would appeal to and resonate with the men who were lacking in that healthcare. We weren't sure, this was an experiment. It seems so intuitive now, but when you're doing it, are people really going to go to a Men's Center? Are they really going to understand what it even is? So we built one floor in Midtown Manhattan, and now we have 4 in the same building, exclusively on men's health, led by literally every physical specialty that you would need. And you come in, you see your internist. I always like to say, and I don't think we have any internists here, but internists are great when you're healthy. But when you get to a point where you actually need something, they can keep you healthy, obviously, and I'm being a little tongue-in-cheek here, but when you actually need something, when your knee goes out, having that gatekeeper like Steve Lamb, your physician, can actually connect you to the right places, an endocrinologist, a pulmonologist, cardiologist, being able to do it in one place on one medical record. We use something called Epic. We were the first Epic customer in New York City, which gave us another advantage, being able to sort of integrate the Epic technology with our own homegrown technology, so we can, connect with our patients pretty easily. I don't know how many people in this room are NYU patients or use our facilities, but I think you'll find our tech, our ability to communicate out and people's ability to communicate in to us is pretty exceptional and makes a difference, because we got to make sure men have access, and because they want it when they want it. This is also New York, and they want it when they want it, and we got to be there to catch them when they need us.
And you don't want to give them any excuses, right? You don't want to say like, well, it's too inconvenient to find a new physician or to get that referral. It's all baked in, and something that NYU Langone has been investing in quite heavily is a sort of, I don't know if you call it a telehealth platform or something that allows for real-time 24/7 access to your physicians. Tell me a little about the decision to make those investments.
Yeah, so that's a decision we sort of had to make. So one of the challenges of being successful in what you do is, there's an unlimited demand for our healthcare that we provide. And unfortunately, there's limited supply. We've got 4,400 doctors, but there are many specialties. If we had 5,400, I'd fill them up, their patient slots in a day. So getting to see us is hard. And what we wanted to do is build a second channel, a second pathway where people could see us in real time, pretty much any hour of the day, for an acute problem that doesn't require you going to an emergency room. So we were actually doing this before COVID. COVID certainly accelerated the work and people's awareness of it. So we have two pathways now. We have a virtual urgent care program that's staffed by emergency room physicians.
And they have access to your full health data. You're not going in cold to some random urgent care center.
You go online through the app. Even if you're a new patient, you can download the app. You go online, and you can book an appointment literally within 15 minutes with an emergency room physician, and they can treat probably 90% of what comes their way. And, and if they're concerned about something, they're going to say, hey, come on into the emergency room, and we're going to be ready to treat you. So that's one pathway. We've also built facilities where we have nurse practitioners sitting outside of the physician office, where if you want to see your physician, you wake up with a headache today, right, or you're a little achy, your doctor isn't sitting around with nothing to do waiting for you to call him and say, hey, come on in. That's not how healthcare works. So you can actually log on, see that he's not available, and select an appointment with someone who works with him, who's a nurse practitioner, who has access to your record through Epic, knows all your health conditions, sees your latest test results, and is usually able to treat, again, 90% of what comes our way.
I can attest this is all accurate. Before I let you go, I want to talk about something that I've noticed as a patient, which is the food at NYU Langone is amazing.
It really is good.
Everyone jokes about hospital food. It's like airplane food. But it's actually really good. That's another intentional action an investment on your part to enrich and enhance the experience.
Yeah, I don't want anyone to have to come to our hospital to actually hear and listen to what experience what he's talking about. But if you're ever on First Avenue and you want to go to the cafeteria, it is worth a visit. Good food really matters, and in a hospital, you're sick. We all think about lousy hospital food. Your state of mind. This isn't necessarily about nutrition, because other hospitals do a good job with food as well. But in terms of nutrition, the right way to eat. But how you feel helps you get out of the hospital faster. And our chef, Chef Jeff, who's an amazing guy, just did a TEDx talk with NYU, which is worth seeing online if you get a chance. He's a professionally trained chef, accessed our healthcare system through family, saw what his parents were going through, and said, we as a healthcare system, we as a society need to do better for patients who are in the hospital. So he, with the support of our CEO, who's a complete and total foodie, really gave him the runway, the platform to completely rethink how we do food at NYU. So I hope you never have to try it, but if you are in our hospital, it's pretty good.
So we actually, NYU Langone gave us behind the scenes access to Chef Jeff training a new chef. And I think we have video of that if somebody can pull it up.
NYU Langone and Hearst have partnered to combine editorial and medical expertise focused on wellness and longevity. With me today is Jeffrey Held, aka Chef Jeff.
Today we're making shakshuka, a vibrant, spicy North African dish where eggs are poached in a rich tomato sauce. What's your best tip?
You gotta eat food that you love. Cheers, Chef.
Cheers. It's pretty delicious.
I'll take the win.
It was pretty good, actually. So without further ado, I think we're going to get things started. So thanks so much for coming, and enjoy the program, everybody.